Can you hear me all right? Fantastic. Okay, so my name is Pamela Hopwood. I am a master's student at the University of Waterloo at the School of Public Health and Health Systems under the supervision of Dr. Ellen McEachen. And my presentation today is called Health Workers' Health on the Line, the case of Ontario's personal support workers. And I will be going through a couple of terms that I'll be referring to through this presentation. So I'll be using PSW to refer to personal support worker, LIN for local health integration network, which is a group of organizations, administrative level, that coordinate regional care under the Ministry of Health in Ontario. SPO stands for Service Provider Organization. There are 41 of these organizations across Ontario which provide PSW home care services for the province. And these service provider organizations are contracted by the LINs to provide home care services. LTC stands for long-term care, although I'll be focusing primarily on home care as that's the focus of my research. And then also the term unregulated. I'll be using this to refer to the fact that PSWs are not part of a professional body or a college. Unlike many other workers in the healthcare system, such as registered nurses and occupational therapists, physiotherapists, and so forth. Okay, so the objective of my research is to explore policies and to look at PSW work and client safety and how it's considered and operationalized within the home care system, with the aim of identifying policy gaps that may lead to unnecessary risk in home care. Here we go. I'll be using critical analysis throughout my research to explore the power relations and consider the positionality of the speaker, as well as to retain the system context and to understand the multi-tiered system that shapes safety in home care. In an era of global population and aging, people are living longer, and aging baby boomers make up an increasingly large proportion of our older population. And this is driving the need for increased home care services. And we also have a lack of space in long-term care that is contributing to a need for more home care. At the same time, there is, as you've heard probably during the pandemic, a long-standing shortage of personal support workers on the front lines. In a broader context, there's systemic intersectional inequity involved in care work. PSW work is care work that exploits not only women's labor, but also racial and ethnic minority women's labor. And in Ontario's socio-political context and environment, there's also been noted a worker responsibilization for health and safety, and that's putting the onus on PSWs. Now, all of these factors are particularly relevant given that 95% of PSWs in Ontario are women, and that racial and ethnic minorities, as well as immigrant women, are overrepresented in this workforce. In terms of Ontario, the system organization is very fragmented and multi-tiered, and this is in terms of funding, administration, and oversight. There are many levels and layers of policy. For healthcare specifically, the Ministry of Health oversees the funds, and then it filters the funding down to the local health integration networks. The LINs then engage service providers, organizations, in contracts, and the SPOs are the employers of PSWs. As I mentioned, there are 41 different service provider organizations across Ontario that currently employ PSWs. So within this system context, there is an interrelatedness that I felt I could not ignore in my research. And this is between clients, families and informal caregivers, as well as the paid caregiver on the front line. And my research focuses specifically on this relationship between client and paid care and PSWs specifically. But I've been asked repeatedly, so do you mean you're focusing your research on clients, or are you going to focus on workers? And my answer is yes. Client and PSW safety is interrelated, and there's increasing recognition of this in literature. For example, one study incorporated a triad of participants, which were identified as a set, and this included family and informal care, clients, and paid caregivers. And they researched this as a unit and took everything within the context of those interrelated factors. So what I found is that there's limited policy at the level of the Ministry of Health that addresses PSW provided home care specifically. While Ministry of Labor standards and occupational health and safety standards that apply to all employees in Ontario do apply to PSW workers, this can be further complicated because PSW's workplaces are people's private homes. And another aspect of PSW work is that PSWs frequently perform controlled acts under the delegation of a nurse. Now, this is covered by the Regulated Health Professions Act, which defines what acts are regulated, what can be delegated, and passed on to unregulated care providers. However, when you look deeper into practices within this structure, what you find is that home care PSWs are usually provided one training session with whichever nurse is delegating this service or the act, and there is little, if any, follow-up, and that PSW will be essentially practicing under the nurse's license per se and conducting these acts without any supervision or follow-up. So this leads to some of the policy gaps that I'd like to highlight today. And among these, as I mentioned, there's limited Ministry of Health policy, especially regarding supervision or reference checks or how service provider organizations should operate in this context. So most of the policy at the ministry level, of the Ministry of Health level, relates to the cost of services, the amount of services that should be provided, and procurement procedures. For PSWs, as I mentioned, there's no professional college, and therefore they are unregulated, and they have no defined scope of practice. So there is less definition and boundaries around their activity. There's also no registry of workers. And this is despite 2 attempts in the past decade to gather the information about personal support workers in one location provincially. Now, with their 41 service provider organizations in home and community care, as well as long-term care agencies, as well as other private employees and some hospitals that employ PSWs, there are countless employers. And there is no central source of knowledge for verifying PSW education or vetting past performance, short of what workers themselves will provide on applications. Now, this is common in many other jobs and workforces. But what's important to consider here is that this work involves working with a very vulnerable sector. So the implications of this, as I've alluded to, is the worker is almost always working alone, unsupervised, and they are performing intimate, close personal care, as well as frequently delegated nursing tasks. On top of this, PSW work is precarious. So these workers have low wages, usually minimum wage, although most have been given a $2 or $3 increase during the pandemic, depending on their position. However, they still have no or few benefits, and the hours in home care are specifically insecure. They can change daily, with clients requiring more or less service, moving, no longer requiring service. And on top of that, the work is part-time to begin with most PSW positions being part-time. Another concern in PSW work is the scheduling problems, and this may complicate the situation for PSWs. They're often having to work more than one job, and yet there are peak hours of demand for services. So particularly in the mornings, a large number of people may need assistance in their activities of daily living, getting up, getting dressed, and so on. Additionally, there's a concern regarding travel for the workers. And this may include anything from the cost and of maintaining and operating a vehicle, from hazardous road conditions, winter weather, or even something like public transit and taking the bus or subway, which increases your risk of exposure during circumstances like the pandemic. And lastly, PSWs are often not paid for this time spent in travel, which therefore further limits their actual paid working hours, which are already minimal. There are other health and safety concerns for PSWs, such as environmental concerns, which include physical injury, exposure to infectious disease, mental health concerns, particularly surrounding stress. Fatigue and burnout have been major considerations during COVID-19. And violence can also occur in multiple ways in home care. This may be from client to worker, from worker to client, and it also may involve the family or other members of the household. So it's not your typical workplace. Some of these factors may lead to why retention is a huge issue in PSW work. You may have heard the news and continued investment in retraining or training new PSWs to provide adequate care. And this is, again, something that has become exacerbated need for during the pandemic. And yet, despite training new workers, we know they're typically not going to stay in great numbers. 4,000 of 8,000 newly trained PSWs left the job before the end of their first year, and that was reported by Home Care Ontario in 2019. The Ministry of Health and Long-Term Care reported 60% turnover annually in 2016. So this is nothing new. This is nothing surprising or shouldn't be that has come to a head during the pandemic. And the implications of this, well, you've got inconsistency among workers, new workers starting. You've got an increased number of strangers coming into a household. Workers also are experiencing new conditions. They're in places that they haven't traveled to before. They're adapting to an entirely new set of ergonomic practices and care provision procedures with a new client. And this turnover just generates increased newness for both client and worker. This can lead to mistakes due to the new tasks. And there's also, as I mentioned, with scheduling problems, it's common that there are missed visits, which affects clients. The clients themselves are a vulnerable population. Almost 60% are over the age of 65. And as we know in our context of an aging population, this proportion is only going to increase. Unfortunately, the data that we have about safety in home care is also often not holistic, or it's incomplete. And part of that is because of the multiple service provider organizations. There is some common tracking methods, but that service providers report to the LHINs, which then reports to Health Quality Ontario Ministry of Health. And yet it's still limited, it's not holistic. So for example, there's a study I'm going to refer to, and Doran et al. And this study looked at adverse events in home care. And the way they define adverse events was physical injury requiring emergency room visits. Well, you can well imagine there are many, many issues that may be adverse events well beyond that definition. Among the very few surveys or data that we have pertaining to safety, a 2018 Pan-Canadian study showed that service providers can be responsible for anywhere from 4 to 9% of instances of physical, sexual, psychological, and financial abuse and neglect. Now, if you think we have no common source for tracking workers specifically in a province, the only way that this knowledge is available for service providers is either through references, if the person's caught and criminal charges are laid. So as a takeaway, I hope that I've illustrated that it's important to consider both worker and client safety together, as these are very interrelated issues. And this is key to improving home care safety for both vulnerable parties. I hope that contribution of my research will help identify system level risks for PSWs and for their provided home care and for client safety. And also to elevate awareness of safety issues that affect vulnerable parties who have minimal opportunity to disseminate concerns. And in closing, I just want to read this quote. It's just published in September in The Lancet in an article that looked at the interrelatedness of home care, of healthcare worker safety generally, and patient safety. And they said there now needs to be a universal recognition that health worker safety is patient safety. One cannot exist without the other. Thank you.